This is a video covering different vital signs, how they're measured, what they mean, how we can interpret them, those sorts of things. All for 212 vital signs. So vital signs are often just referred to as simply your vitals. If you're working in a doctor's office, they'll say like, "Oh, I've got to go take the patient's vitals," or in a hospital or something like that. You'll hear that often, and they're basically measurements of some of the body's basic functions, especially those that relate to the body's ability to maintain homeostasis. It's really important that your body is maintaining homeostasis, meaning maintaining consistent internal conditions in a variety of ways. And so your vital signs are looking at a variety of different measurements that we can use to kind of see how well the body is doing that. And so this includes looking at your heart rate, also known as pulse, respiratory rate or breathing rate, body temperature, blood pressure, oxygen saturation of the blood, so like how much oxygen is in the blood, and then also height, weight, body mass index, those sorts of things, which are calculated using a person's height and weight. These are all considered vital signs. So the first one is heart rate, and this is simply the number of times that the heart beats in 1 minute. It's a really important vital sign. If somebody's heart rate is really high or really low, they could be signs of different things. So one complete sequence of pumping and filling of the heart includes 2 phases, essentially. So there's the contraction phase, or the systole, and this is when the ventricles are contracting and pumping blood out of the heart, right? Don't forget the ventricles, those lower, larger chambers. Those are the ones that are going to contract and pump blood out. Then there's the relaxation phase of the diastole, and that's when those ventricles, those lower chambers, are filling back up with blood. And the average adult at rest completes 75 cardiac cycles per minute, or 75 heartbeats per minute. And so that's going to be somewhere between like 60 to 100 is kind of like your normal range. You've probably seen a chart like this before when you've gone and exercised at the gym, or you've used a treadmill or an elliptical machine or a bike and doing any sort of like cardio work when working out. You've probably seen something like this where it kind of gives you a range of like your maximum heart rate and what you want to be shooting for and that sort of thing, and what your maximum heart rate might be. And this differs for different people, different ages, different sizes, sexes. But this is one thing that heart rate is used for, right? Trying to get an elevated heart rate is why we call it cardio, right? Cardio, cardiac, referring to the heart. And so knowing kind of what your normal heart rate is can kind of help you kind of target a certain heart rate zone, right? For example, and there are different benefits from those heart rate zones. All right, next important vital sign is respiratory rate or respiration rate. This is recorded in breaths per minute, very similar to heart rate, which is in beats per minute. They're both BPM, but one stands for beats for heart rate, one stands for breaths for respiratory rate, but you'll see them both listed as BPM. And your normal respiration rate for an adult is between 12 to 20 BPM. And your respiration rate can be influenced by a whole different things. Of course, if you're exercising, you're going to be breathing faster, but other things in addition to exercise would include stress, how much carbon dioxide is in your blood, how much oxygen is in your blood, what the pH of your blood is, if you have some sort of infection, if you have some sort of lung disease, how hydrated you are, if there's any drugs in the system, or even just long-term drug use. These could all influence somebody's respiratory rate. And so knowing somebody's respiratory rate can be really helpful. Now, body temperature. Body temperature, of course, if you've ever been sick, which you've probably been sick, you've probably had your temperature taken using a thermometer. And it's a measurement of how warm the body is, basically. It's really important that humans and other mammals and endothermic organisms maintain a consistent body temperature. If your body temperature gets a little bit too high or a little bit too low, a lot of things in the body stop working properly when you're a warm-blooded creature, right? But it can vary slightly. So different people are going to have a slightly different normal body temperature. Normally, for an adult, it's going to be somewhere between 97.8 to 99. It could also even be a little bit lower than that. It just depends on the person. But it's going to be somewhere in that mid-98 range, give or take half a degree or something like that, Fahrenheit. Now, temperature above 100 is considered a fever. That's called hyperthermia. Hyper, of course, high. Thermia, referring to temperature. Usually this is because somebody's trying to fight off an infection or an illness. And it's not usually a concern unless that temperature gets up above 103. Getting up above 103, that's a pretty concerning temperature. I actually had one a couple months ago. It was bad. I felt awful. It was kind of scary. I got in a tub and tried to cool off with some water in addition to like ibuprofen and stuff. Anyway, Now, temperatures below 95 are considered hypothermia. Hypothermia, you've probably heard of as like a danger of the winter and like being out in the cold without proper equipment, without the proper kind of head covering, coat, and et cetera, and all that kind of stuff, which is very, very dangerous. And it could cause organs and body systems to shut down, leading to death. So don't want the temperature too high, don't want the temperature too low. Either is bad. Now, blood pressure, you probably heard of blood pressure before, but you might not really know exactly what it is. But as a reminder, blood is a fluid, and as fluids move through something, they exert pressure on something. So just like water, there's water pressure in like the pipes in your house. There's water pressure in like the big mainline pipes like underground that supply water to all the different parts of the city. There's also pressure from your blood, and we call that blood pressure. So it's this hydrostatic pressure, which is what it's called, and it's basically just the fluid pushing against the walls of the blood vessels. And so when we measure blood pressure, we're going to be measuring the pressure of blood in the arteries. And so that's usually done like out on the arm. And the unit we use is called millimeters of mercury. And it's kind of like an older unit. We don't really use mercury when we're doing it anymore. But just like how like old thermometers used mercury, silver metallic element, and the column of mercury would go up and down in an old-fashioned thermometer. You can measure pressure in the same way. It's often used for like measuring like air pressure, barometric pressure, that sort of thing. But it could also be used as just an overall pressure unit, and that's how we're using it here. So millimeters of mercury, little m, capital H, lowercase g, those are our units for blood pressure. And again, we are measuring the pressure of blood in the arteries. Now, when we measure blood pressure, it's taken in two different measurements. There's the systolic pressure, which is when those ventricles are contracting and pumping blood through the arteries, like we talked about earlier during the cardiac cycle. And there's the diastolic pressure. And so when we take a measurement, we take this as like a reading that almost like a fraction. We say put the systolic number on top and the diastolic number on the bottom. And so we might say something like 112 over 74. And what we mean when we say 112 over 74 is the systolic, the high pressure, the kind of the peak pressure during that contraction, like we see here in this graph, right? During the time when the ventricles are contracting and pushing blood through the arteries, that peak is at 112 millimeters of mercury. And then 74, we mean that to be the diastolic, kind of like the lowest, the minimum pressure as the blood moves through the arteries. So as that heart is relaxing. So it's kind of like a ratio, systolic over diastolic. And normal healthy blood pressure is going to be under 120 for the systole and under 80 for the diastolic. And so this little graph here, right, just shows you like over the course of one heartbeat, one cardiac cycle, when those ventricles contract, we see the pressure in the arteries, right? This is actually the aorta right here. The pressure in the arteries increases, and then it kind of comes down, flows down. This is actually this little thing right here. This is valve closing. That's cool, huh? And then it'll come back up when the heart contracts again. All right, there's a video here. I'm not going to watch it in here, but this is linked on Canvas for you. So if you keep going on Canvas and modules, you'll find this video about understanding blood pressure. I encourage you to watch that. And so then here is kind of like a little chart breakdown. This is actually from American Heart Association of the different categories that we use for different blood pressure numbers. So like I said before, normal, we're looking for under 120 over 80. If you have a number above 120, in the 120 to 129 range, where the diastolic is still less than 80, that's considered elevated. Probably not that concerning. And this sort of thing can happen if somebody's like, even if somebody normally has normal healthy blood pressure, but they're a little bit nervous, or they just like power walked somewhere or whatever, you could get like a slightly elevated blood pressure just from that alone. Probably not a major concern. And people's blood pressure can fluctuate throughout the day to day, week to week. But when we start seeing blood pressure numbers even higher than that, so diastolic above 80, between 80 and 89, and systolic between 130 and 139, that is considered high blood pressure or hypertension. If you've heard the word hypertension, that is referring to blood pressure. And so there are different stages of hypertension you can see here. There's stage 1, there's stage 2, which is even higher still, and then there's a hypertensive crisis. This is actually very dangerous. Consult your doctor immediately. Higher than 180 and or higher than 120. Long-term high blood pressure does damage to the cardiovascular system. It damages the blood vessel walls, which can lead to the development of plaques and atherosclerosis. It can stretch out the walls of the blood vessels, lead to a whole host of cardiovascular issues that can lead to things like strokes and heart attacks and heart failure, congestive heart failure, these sorts of things we learned about back when we were discussing the heart in 1.2.5. So hypertensive crisis, consult your doctor immediately. Very important to try to get that down and under control because that is dangerous. So, a variety of things can influence blood pressure. Like I said, some things can just be kind of day-to-day, stress, what you've been eating, how much you've been drinking, are you getting well hydrated, are you exercising regularly, but also things that are a little bit more outside your control, like your age or your genetics. So there's a whole different host of things that can influence blood pressure, cause it to be higher, cause it to be lower. People who are older, their normal blood pressure ranges are different than people who are younger, for example. But also there are a lot of things that you can control to try to bring down your blood pressure. So if you do have blood pressure problems, especially as you get older, there are a variety of different steps you can take. Big ones including the obvious ones, right? Diet, exercise, maintaining a healthy weight, not smoking, not drinking too much, not doing drugs that are going to mess up your body, right? There's all kinds of different things that are within a person's control to try to help them with blood pressure. Although there are, like I said, some factors that are outside your control, right? Some people are just predisposed genetically to different blood pressure. A concept that I just want to briefly cover that you don't need to worry too much about, like how to calculate this or whatever. And so if you want to skip this part of the video, honestly, you can, is mean arterial pressure. And the idea here is that this is a measurement you can use the systolic and the diastolic numbers to kind of get a calculation of like how well the heart is supplying blood to the rest of the body, to the body's organs. So this is especially something that is concerning when people have low blood pressure, because just like how people can have too high of blood pressure, you can actually have too low of blood pressure as well. And so people who have issues with blood pressure being too low, sometimes they'll often like pass out. And that's because they're just not getting enough blood to their brain. And they might also not be getting enough blood to some of their other organs, which can be bad, can damage those organs. And so mean arterial pressure, the idea is that you want mean arterial pressure to be between 70 and 100. And if it's lower than 60, when you calculate it out like this, where you count the diastolic twice and divide, then that can be dangerous as well. All right, then we have oxygen saturation. So oxygen saturation, here, and you can see the pulse oximeter over here. Let me move myself. Boop. All right, there we go. Oh, too far. Oxygen saturation, like I said before, it's basically just saying how saturated is the blood with oxygen. So your blood should be carrying a lot of oxygen. Normal peripheral oxygen saturation, which is given as abbreviated SpO2, is between 95 to 99%. If you're between 95 and 99%, you're good. Below 90, though, is a sign of condition requiring immediate treatment. So this is something that if you heard about people being hospitalized during the pandemic with COVID, oftentimes people would ask, oh, well, what is their blood oxygen saturation? That was a very common question because it was kind of a good estimate for like how significant their illness is. And under a certain number, like under 90%, is when we needed like ventilators for people. And if you, I don't know, you guys were kind of young at this point during this, but if you paid attention to the news, like, oh, there's some hospitals didn't have enough ventilators. And so they're doctors and nurses were having to make really difficult decisions. And part of the way they were making those decisions was by knowing what the patient's oxygen saturation was, because they weren't going to use a ventilator for a patient unless the patient really needed it. And so keeping track of that person's oxygen saturation is really important. And this is often done with something called a pulse oximeter, and you'll be using it over in the lab over there. We've got these. You just clip it onto, you turn it on, you clip it onto your finger, and it gives you both your pulse and your blood oxygen saturation, hence pulse oximeter. So just like you can see up here, we got blood oxygen saturation here, 98 SpO2 percentage, and then we also have the pulse here in BPM, beats per minute. So this person's 78 BPM, right in the normal range, and nice healthy oxygen saturation there at 98 as well. So oxygen saturation can be decreased due to, like I just talked about, right, respiratory illness like COVID, but also things like asthma, heart disease, anemia, which is when there's not enough iron and there's not enough red blood cells in the blood. COPD, which is chronic obstructive pulmonary disorder, which is kind of like the other side of emphysema. Emphysema and COPD are both these chronic disorders of the lungs and the respiratory system, and you can get both of them from smoking, so don't smoke. Also, heart defects, high altitude. It's a lot of different things going to influence your oxygen saturation. But as you hopefully will find, yours hopefully is somewhere between 95 and 99 when you go take your vitals today. All right, finally we have BMI, and BMI is body mass index, and this is used as a rough approximation of how healthy somebody's body weight is. It's kind of crude though. It's only using height and weight. And so this is actually, like, body mass index is a metric unit that uses kilograms and centimeters. And so we have this weird conversion when we go to do it in pounds and inches where we have to multiply the number by 703. It's just because in order to get it, we have to account for the fact that pounds and inches are not kilograms and centimeters. So high BMI can be an indicator of high body fatness, basically a high amount of body fat, but not always. So here are your kind of different ranges. Normal range, healthy range is between 18.5 and 24.9. Once again, it's like a ratio. And then when you go above that, there's the overweight category, there's the obese category, then there's even like extremely obese or what's sometimes called morbidly obese. But there's also underweight. Under 18.5 is considered underweight. Now, these numbers are used for adults. Many of you are teenagers are still developing, and so your BMI might be different. Oftentimes, like, children's BMI is not going to look the same. So if you're like 14 or 15 years old and you wind up with an underweight BMI, might not be a reason to be concerned. You might just, still be developing. All right. We don't use BMI with children generally. You guys are getting to be adults. You're getting there. All right. Here's a little chart kind of just showing like different heights and different weights in pounds. So if you know your height and you know your weight, you can kind of figure out what your BMI is based on what that is if you're curious. But you could also calculate it, right? You just do it according to this equation here. So just make sure you do the things in the parentheses first, right? So square that height first, divide that weight by the height squared. Once you have that, then you multiply by 703, right? PEMDAS. Make sure you're doing your order of operations there for BMI. Things to be aware of with BMI, though, is that, like I said before, it's a rough approximation. It's not going to tell you exactly, like, if exactly how healthy you are, for example. It's also not very useful for, like, really elite athletes who have a lot of muscle mass. So, like, weightlifters, football players, especially, like, people who have a lot of muscle. Muscle is heavier than fat. It's denser than fat. And so people who have a lot of muscle in their bodies, they tend to weigh more. And so they could be considered obese according to BMI when you can look at them and be like, that's not an obese person. That's a really fit person. So just something to be aware of with BMI. All right. That brings us to the end of the notes on 212. Let me know if you have any questions. Hopefully that was illuminating.